obesity rates tend to be higher in women compared to men. In the US, about 44% of women are obese, as compared to 40% of men. Contributing factors include hormonal fluctuations during pregnancy, menopause, higher rates of emotional eating, and socioeconomic factors. For example, women may have less access to healthy food or time for physical activity due to caregiving responsibilities. Women with obesity are at higher risk for reproductive health issues, such as polycystic ovary syndrome, as well as diabetes, heart disease, and mental health issues like depression. Men also face significant obesity rates, with around 40% of men in the US classified as obese. Contributing factors include higher rates of binge eating and drinking, and certain societal norms may discourage men from seeking help for obesity. Men are at increased risk for heart disease, type 2 diabetes, and some cancers, including colon and prostate cancer. Obesity rates are generally higher among individuals with lower income levels. In the US, contributing factors include limited access to healthy food, food deserts, less time for physical activity due to multiple jobs or other responsibilities, and lower levels of health literacy. Obesity is linked to higher rates of chronic diseases such as diabetes, heart disease, and hypertension. Additionally, low-income individuals may lack access to healthcare or weight management programs. Higher-income individuals tend to have lower obesity rates, though obesity is still a significant concern in this group. Contributing factors include access to healthy food, exercise facilities, and healthcare. However, sedentary lifestyles due to long work hours and stress can still contribute to obesity. While rates are lower, obesity still poses health risks in this group, including cardiovascular disease and certain cancers. Obesity rates are generally higher in rural areas compared to urban areas. Around 40% of adults in rural areas are obese, compared to 35% in urban areas. Contributing factors include limited access to healthy food, fewer opportunities for physical activities such as gyms and walking paths, and economic challenges in rural communities. Rural residents face higher rates of obesity-related diseases such as diabetes and heart disease. The obesity crisis is a multifaceted issue that varies by age, gender, race or ethnicity, socioeconomic status, and geographic location. Addressing obesity requires a comprehensive approach that considers these demographic differences and tailors solutions to the specific needs of each group. Interventions should focus on improving access to healthy food, increasing physical activity, reducing stigma, and addressing the broader social determinants of health. Obesity rates vary significantly across different racial and ethnic groups, with certain populations being more affected than others. Obesity is more prevalent among Black adults, with about 49.6% of Black women and 38.2% of Black men classified as obese. Contributing factors include socioeconomic disparities, limited access to healthy food, cultural dietary patterns, and higher levels of stress due to racism and discrimination. Black Americans are at increased risk for hypertension, diabetes, and heart disease. There is also a higher prevalence of obesity-related health issues like stroke and kidney disease in this group. Hispanic Americans also face high obesity rates, with about 47% of Hispanic adults being classified as obese. Contributing factors include cultural food preferences, socioeconomic challenges, and limited access to healthcare. Hispanic populations are at a higher risk for diabetes, hypertension, and metabolic syndrome due to obesity. The prevalence of childhood obesity is also higher in Hispanic children compared to white children. White Americans tend to have lower obesity rates than Black and Hispanic populations, though the rates are still concerning. Around 40% of white adults are obese. Contributing factors include dietary habits, physical inactivity, and socioeconomic status. However, some studies suggest that rural white Americans may face higher rates of obesity due to limited access to health care and nutritious food. Increased risk of heart disease, diabetes, and certain cancers is similar to other groups. Obesity rates among Asian Americans are generally lower than those in Black, Hispanic, and white populations. However, some subgroups, for example Southeast Asians, are at higher risk for obesity-related health conditions, even if they are not classified as obese by BMI standards. Contributing factors include differences in dietary patterns, genetic predispositions, and acculturation, including the inability or inner conflicts in adopting Western diets and lifestyles. While obesity rates are lower, Asian Americans still face high risks for type 2 diabetes and cardiovascular disease at lower BMI thresholds compared to other ethnic groups.